Good morning, everyone. Thank you so much for joining us today. My name is Sharon Tubbs. For those of you who are unfamiliar, I am the Director for Health Visions Midwest of Fort Wayne, and we run the Allen County Health Equity Coalition, formerly the Allen County Health Disparity Coalition. We are so grateful for your presence here this morning. I'm sure that some others will be beeping in as we go along, but right now it is 10:01. And I am trying to be mindful of the time and everyone's time. So we want to go on ahead and get started. I hope that each of you did receive an agenda for this morning's meeting. We have a great presentation in store, a very timely one, always timely to talk about Alzheimer's. But I'm going to open up or we are going to open up with a word of meditation. For those of you who are unfamiliar with Health Visions, we are a faith-based agency, and so we do in our meetings with a word of prayer or meditation. However, it is not our intention, of course, to offend anyone. So if you're not into that kind of thing, please, Lord, about 30 seconds. And when we're done, I'll do this wave and you can come back and join us again. Okay. And so this morning, one of our community health workers is going to do the meditation. Gabby Lemos, she is our Latina liaison and community health worker. Gabby, go on ahead and lead us.
Thank you, Sharon. So I got this meditation and just to think about something that happens to all of us every morning. So it goes like this. Just as you finally get moving to tackle the day, the slowdown starts. First, waiting in the line at the cafe for a cup of coffee. Then traffic once again makes your commute an eternity. Instead of letting your impatience and anger take control, use the time to reflect and see if God is using the wait as an opportunity to speak to you and help you remove your stress.
Wonderful. Thank you, Gabby, for that word. And that is such a great reflection. So many times we are impatient and things happen that we didn't anticipate or did not want to happen. And is that time for us to reflect and think about how God is forcing the slowdown and forcing us to reflect and just take some time to think about our next move and our next step. So thank you, Gabby, for that reflection. I'm waving for anyone who wanted to turn their volume down. We are done with the meditation portion. And so we see, like I said, some new faces. So I do want to take a moment to allow anyone who has not been, is there anyone, this is your first time? This is your first time on. I would like you to, okay. So I would like you to introduce yourself and tell what organization you are with. And so we're going to start with Matt.
Good morning, everyone. Matt Rowan. I'm the executive director for Give Here. And if you're not familiar with Give Here, we provide healthcare, hearing healthcare and hearing aids for those who are financially constrained, and trying to do our part here to make this community a better place. So it's my first time being with you. It's just been a heck of a struggle from a scheduling standpoint. I've been with Give Here for about 10 months, so glad to be with you this morning.
Matt, thank you so much. We all, or maybe not all of us, but we've heard of, many of us have heard of Give Here, obviously. And so we are grateful for what you guys do in the community. Anyone else? This is your first time. Okay, Betsy's got her hand up.
Hi, I'm Betsy Kochmar. I'm the AARP representative for Fort Wayne, replacing Linda Dunno, who was promoted to being president of the state AARP. And so I'm taking her spot on this council representing AARP Indiana.
Wonderful. Thank you, Betsy. Of course, we all know and love AARP. Was that Brittany? Okay, so Brittany's next.
Hi, well, I'm Brittany and I'm a health navigator and a community health worker for Aspen, which is Affiliated Service Providers of Indiana. I provide free assistance to all Hoosiers with marketplace insurance through healthcare.gov, as well as Medicaid programs. So I provide free assistance with enrollments through Medicaid and also follow-up appointments, just there to act as an advocate for people trying to get on health insurance through the state or marketplace.
Wonderful. Okay, Brittany. And I think Leo comes from, yeah, okay, so
He's no longer with Aspen, so
Oh.
I got this invite or forwarded this invite yesterday afternoon and decided to join last minute.
Okay, well, wonderful. We're glad that you came on out.
Thanks.
Anybody else? This is your first time. Okay. Anyone, this is your second time or you haven't been here in a while?
Me.
Okay, come on now. I knew I would get her sometime.
Well, yeah, it's been a while since I've been here because I kind of like bowed out in another representative. I'm with the Center for Nonviolence. My name is Kalila Hanan. And another representative was in place, and we tend to shift and change places. So it's my turn again to come back and be a representative for our organization.
Oh,
I am a women's program facilitator and also a staff administrative team member.
okay. Kalila with Center for Nonviolence. Welcome, welcome, welcome. We're glad that it's your turn again. Okay, anyone else that I have missed? It's your second time or you haven't been here in a long time? Okay, I see Lisa and Janelle. Lisa, then Janelle.
Hi, I'm Lisa Sheely, and I'm the enrollment director with Aging and In-Home Services PACE program, which is a new program here in Allen County and actually this whole end of the state. So, and this is my second meeting.
Okay, and this is, what program is it with Aging and In-Home?
It's PACE, P-A-C-E, and it's a collaboration with Parkview Hospital. It's a program that brings nursing home services to people who live at home.
Okay, awesome. Janelle.
Actually, I'm a co-worker of Lisa's. I've been here, but it's several times, but it's been quite a while. I work with Aging and In-Home Services, and I am working at PACE. So kind of here for both of those programs.
Wonderful. All right. Well, thank you all for coming out today, or I guess logging in is what we should say. You didn't come anywhere, you just logged in. Hey, Brenda, good to see you again. And good to see everyone. So without further ado, what we're going to do is we're going to get into our presentation today about Alzheimer's, and then we're going to have some networking time and some sharing time so that we can all get up to speed with what each other is doing. So I want to introduce our speaker. Her name is Maggie Cattell. She is an Alzheimer's professional who helps community members throughout their Alzheimer's and dementia journey by connecting them to care, support, and local resources. Maggie has her master's degree in liberal studies where she focused on psychology and sociology. She has a strong background in creating humanistic programming that centers on individuals' experiences and outcomes with nonprofit agencies. She is a passionate provider of support and a strong advocate for issues affecting older adults. So as you can see, Maggie has a very interesting bio and can tell that she's quite credentialed and qualified to do this presentation this morning. So Maggie, are you ready to share your screen? And
I am ready, and I'm gonna do you all proud, I promise. I'm there's lots of people and organizations on here which I get to work closely with, so I'm super excited. Good morning, everybody. So before I share screen real quick, Sharon, when it comes to these presentations, before you guys sit back, drink your coffee, and listen to me lull you into the Alzheimer's and dementia world, I really would hope if you guys wouldn't mind typing in the chat if you know of somebody or somebody you loved currently or in the past has had an Alzheimer's or dementia diagnosis. I know when it comes to these presentations that if you're not working with seniors, it's really easy to just kind of sit back and kind of have it going in the background. And I see yeses starting to come in. So I want to make sure that as we go through this presentation, if it's not something that professionally is going to impact you, there's a very good chance that personally it could impact you. Oh, we've got people, oh, somebody's father. Yes. Got lots of yeses coming in, a couple fathers, and I'm so sorry to hear that. Grandma, grandmothers, yes. You know, Alzheimer's and dementia is a disease that 1 in 3 seniors die with. So it is an incredibly common disease, unfortunately, and it's only going to become more common as time continues to progress. So today what we're going to be doing is we're going to be diving into the 10 warning signs of Alzheimer's. And this is a really interesting presentation because we are now getting out and about. And in some cases, we're seeing people we haven't seen for quite a period of time. If you're like me, I was social distancing, especially with like my grandmother who's 92, some of my older aunties, we were all being really cautious. And as we start to see people again, it's pretty common for us to notice that things might have changed, especially if they're within our senior community. So for those who didn't know, June is actually Alzheimer's Brain and Awareness Month. And it's kind of our chance to bring the conversation of Alzheimer's and dementia back to the forefront. It's actually been a little bit overshadowed because this month we had a huge announcement with a drug that was approved by the FDA, and it's the first of its kind that helps treat also some of the regression that we see in the brain due to Alzheimer's and dementia. So it's been a little bit of a quieter Alzheimer's Brain and Awareness Month, and it's been more focused on this new medication that's come out. Alzheimer's disease is a disease of the brain. So if you have a brain, this is absolutely something that can apply to you. Alzheimer's disease is a neurodegenerative disease. So it's a disease of the brain where it causes the brain to actually shrink. So it goes through and it impacts our abilities for thinking, problem solving, behaviors, emotions. And in the end stages, it actually can prevent somebody from speaking and actually having a hard time swallowing. You'll hear me use the terms Alzheimer's and dementia interchangeably. I'm not doing it to catch you up. There's no pop quiz at the end of this. Dementia is actually an umbrella of symptoms. It's a syndrome. And there are all of these different types of things underneath that cause dementia symptoms, Alzheimer's being one of them. So Alzheimer's accounts for 80% of dementia. Some of the other dementias you might have heard of is frontal temporal, which is a very behavior-based dementia. Dementia with Lewy bodies, which is very common for those who have high blood pressure or cholesterol issues. There's hundreds of different types of dementia. Alzheimer's disease is a type of dementia that is noticed by the plaques and tangles in the brain. So those plaques and tangles go through and keep our neurons from being able to communicate with each other, which results in those neurons dying. And like I said, some of the things that the symptoms, and we're going to talk about those today, but it's problem solving, thinking, and memory loss. As I'm talking today, because there is no cure, one of the main questions I get is, why is it important to know the signs? What's the point in getting a diagnosis? And I will continue to argue this until I'm blue in the face. Having a diagnosis, and the earlier the diagnosis, the better, allows somebody to have a say in what their care looks like. It allows somebody to say, here's what I want the rest of my life, for however long that is, to be. And that is incredibly important and incredibly powerful. As we're going through the presentation, I don't want anybody to walk away and start to panic and think that they have Alzheimer's or dementia. Okay, I don't need any emails after this of people having panic attacks and calls to the neurologist because they feel like all of these apply to them. We're going to talk about what the signs are and what's normal aging and what's abnormal. And I want you to make sure to keep this in context. With that being said, my parents are my best examples that I use throughout this presentation. And I always like to say they have given me their permission to talk about them. So if you're behind your computer screen worrying I'm talking about my parents, they know I talk about them. They gave me their permission. These 10 warning signs are just kind of an overview. You don't have to have all of them. You can just have one. And it's always good to keep it in context of who that person is. One of the most common signs that people know is memory loss. And it's not just forgetting, it's memory loss that actually interrupts what your day-to-day activities are. So forgetting important dates, events, especially the repetition is very, very common. Or when people are having to overly rely on memory aids, sticky notes all over the place are something that we sometimes look for. It is normal for all of us to forget. If you're anything like me, since the pandemic has started, I cannot tell you the day of the week. I just completely get lost in Zoom meeting after Zoom meeting after Zoom meeting. It's one of the reasons I'm so excited for when I'll be back out in person. So this is really not those occasional moments of forgetting. It's something that's actually keeping you from being able to do your normal business every single day. The second sign is changes in planning or being able to problem solve. So this could be known or could pop up in somebody not being able to pay their bills like they normally do, or being able to balance their checkbook. If they were never able to balance their checkbook in the first place, then this does not apply to them. This is only if this is somebody who was always using this kind of strategical thinking. My dad was an engineer. So if bless his heart, he's going through and he's working on the sprinkler systems for our yard, and he has a diagram and he has created different zones for the yard to make sure every blade of grass is watered. That is my dad. You know what I mean? I look at it, my mom laughs at him, my sisters and I laugh. That is my dad. He wasn't doing something like that. He wasn't thinking in that strategic way. That would be a concern for him. The third sign is difficulty completing tasks that we do every day. And one that we normally see is driving. So when people who drive to the same place every single day, or even going to church every single week, and all of a sudden they get turned around and they can't figure out where they're at. It's interesting with what's been happening with the pandemic and people driving a lot less. We are getting a lot more calls about people who are getting lost and are really concerned about whether this is a sign for dementia. Applying it to context is if somebody hasn't been driving a lot this past year, they're probably going to get lost a little bit more. Or if you're multitasking, if you're listening to something on the radio, if you've got a lot on your mind, this may not be applying to you. But if you're somebody who drives to get coffee every single day and at some point you take a wrong turn and you can't figure out where you're at, this could be a warning sign. Confusion with time or place can be a little bit of a tricky one to negotiate. Because like I said, I can have a hard time deciding what day of the week it is. That's pretty typical for me. Somebody who may forget about where they're at or not being able to identify the difference between morning and evening. So that a lot of times we see people who will start to wake up in the middle of the night and they're starting to get dressed, not realizing that it's 11 p.m. So they can't really be able to tell the difference about what period in the day it is and what they should be doing. Trouble understanding visual images and spatial relationships. People who have Alzheimer's and dementia actually start to lose their peripheral vision. This becomes a huge issue when it comes to driving. So it's one of the reasons that we start to pay really close attention to our loved ones when we start to see bumps in the car or scrapes, especially on the passenger side front of the car. People actually very commonly will go to the eye doctor because they believe they're having trouble with their eyes. And in fact, their eyes are fine. It's that their brain is not able to properly pick up what their eyes are bringing into the brain. Number 6 is new problems with words, whether this is speaking or writing. It's very common for somebody who's starting to show some early signs to start using very general terms when referring to people. Hey, you. Hey, baby doll. Hey, girl. They have a hard time remembering people's names, so they create this generic name. That way they don't have to try to go through and get frustrated remembering that person. I've always been terrible with names. So for me, that wouldn't be one. But they may go through and start to invent words. So a watch could become a hand clock. A golf tee would become a golf nail. So they're going through and creating words that may be descriptors, or it may be other words that they piece together, because that's what they're able to recall in their brain. Misplacing things and losing the ability to retrace steps. I will look for my glasses when they are on my face. And I am sure many of you guys have looked for your phone while you're talking on it. So I always love to use my mom and dad as an example for this. My mom has a bag of doom that is her purse. She can never find anything. There's at least 20 used tissues in there. Whenever we're looking for her keys, we're having to dump out her whole bag. My dad, on the other hand, whenever he comes in the door, his keys go on a specific hook every time he comes in. Him losing his keys can potentially happen. If he cannot go through and retrace his steps to find his keys, that's where you start to be concerned. So people not being able to reach back into their memory and slowly retrace their steps, that could be a sign. If you are multitasking, if you walk into the house, you're talking on the phone, and you put your keys in an abnormal place, most of us can go through and retrace our steps and find them. If we can't find them, that would be something abnormal. Decreased or poor judgment normally starts to show its sign with money management, where people are making really outrageous purchases, or they are unable to pay their bills on time where they normally would be able to. It's also, for somebody who lives by themselves, can show up in paying less attention to the way that they look. If it's always somebody who's really well coiffed and always looks really well put together, and they're starting to look a little bit more disgruntled or not as kept up, that could be a sign. As somebody who starts to show these signs and symptoms, they can withdraw. They can sometimes know that they're struggling, and it causes them to not want to socialize because it's uncomfortable. It may be really frustrating with them. They can't remember names, they can't remember words. So keep in mind that withdrawing from normal activities could be a sign. And then changes in mood and personality. So confused, paranoia, anxious, fearful, or when there are really quick mood changes. So getting easily upset when they can't do something the right way. If you're starting to notice these signs, again, I don't want anybody to walk away and panic. If you're noticing these signs in other people, you want to have a conversation with them. And that conversation needs to be done in a loving way. And it also needs to be done in a way where you are willing to walk this journey with them. Because especially with Alzheimer's and dementia, it's not just going to impact that person. What we know is that it is a disease that really impacts the caregiver and the people that are surrounding them. These statistics are going to really drive home what we're doing locally. So before I was in this position, I got to work at Catholic Charities. And I say I got to work because I got to work at Catholic Charities. And I got to work on the first floor with the Immigration and Refugee Department. I was actually running their Senior Community Service Employment Program. If anybody has gotten to work with the people at Catholic Charities, these are some of the most beautiful humans I've ever got to experience. But it was also became a really big part in my heart, where looking at our diverse communities and serving them, when I came into this job, I asked, what are we doing? These statistics, so we know that Hispanics are 1.5 times as likely as whites to develop Alzheimer's. African Americans are twice as likely, and 2/3 of the Americans who actually have an Alzheimer's diagnosis are women. We don't know why. There is a lot more research that needs to be done and figuring out why these communities have the disease more. There's also a lot of work that needs to be done in better educating and better supporting these communities, which this is where our local work comes in. So I've got 2 goals that I'm working with, and that's diversity, equity, and inclusion, and faith outreach. I have been blessed enough to have two Spanish-speaking volunteers who have been helping drive home and launch what is going to be our new outreach plan for our Hispanic immigrant population in Fort Wayne. We are starting with short videos which educate about what the disease is, and we are hoping that we are going to be branching out into longer education that is going to be starting in the fall. With that being said, we recognize that going through and just translating an education program is not enough. We need to take into account the different culture, different family dynamics, different religions. This needs to be something that is really given a lot of time and effort. So I urge you, if this is something that sounds like you would like to get involved, please reach out to me, because we are really excited about some of the work that we're going to be launching for this immigrant population. And I think it's the first step in us working into a broader immigrant population. We are also starting to work on reaching out to our Black and African American community, and we're trying to do that through the churches. So I don't have any volunteers to lead that. So if you are somebody who knows a lot of people or is passionate about that, I urge you to send me an email. I am really getting an awesome opportunity to sit back, listen, and learn, and then help motivate volunteers as we kind of drive this forward. Here are some of the resources that we have. If you don't have this helpline number, I always tell people to jot it down. It's available even at 2 o'clock in the morning. And this is something that is available in over 200 languages. So anybody can speak to a licensed, trained social worker. If their loved one has woken up in the middle of the night, locked themselves in the bathroom, and they don't know what to do, they can actually speak to a crisis counselor and they can help with them in that moment. And I would be completely remiss if I didn't bring up our Walk to End Alzheimer's, which is coming up in October. This is where all the funding comes in that keeps all of our programs and services free of charge. If you've never been to the walk, it is just an incredibly powerful day filled with people who are really motivated to one day see an end to Alzheimer's. Alzheimer's Association is the third biggest funder of research in the world. We're only behind the American and Chinese government. So that's what's so cool, is the money that we're raising is truly going towards finding the cure. So that is what I have for you guys today. Are there any questions?
Hello? We're ready for questions.
And if there's not, that's okay.
Well, I have a couple just to get things going, Maggie.
Sure.
Thank you for that presentation. It was very informative. As you're going through, I'm thinking about, myself and forgetting and all of that, but also some loved ones. One question is, you showed us 10 signs for Alzheimer's. Is there any number that should concern us? Say we recognize, 3 or 4 of those signs in someone, or just one. So at what level should we be concerned?
I would say it also depends on what degree that, within those. So for example, if you have somebody who's really experiencing that memory loss and they really cannot get through the day, that would be a lot more concerning than somebody who's experiencing 4 of those signs, but it's only every now and again. So especially with some of the dementias, what we know is that the signs can be they can be hard to see, especially if it's a frontal temporal dementia. What comedian was it that just passed away? Robin Williams, who passed away, who committed suicide. He had a frontal temporal dementia. So that dementia is a very behavior-based dementia, which can actually have a lot of signs and symptoms along with the psychosis, similar to schizophrenia. So that's what's so interesting, is these signs and symptoms can be very unique to the person. So I would always say, if you're noticing any type of behavior change, to have a conversation. But before you panic, there are lots of things that can look like dementia or Alzheimer's. Higher low blood pressure, higher low glucose, mental illness. So that's why we always tell people to have a conversation with their loved one and then go see a doctor to find out what's really going on.
And I remember having a conversation with a dietitian a couple years ago about a loved one, and she asked me, she said, well, how much is her sugar intake?
Yep.
And I started thinking like, oh wait, there have been a lot of sweets, and it just has this craving, and once cut down on that sugar intake, things seem to get drastically better. Another
thing is UTIs. So as our seniors age, it's really common to have a urinary tract infection, and it can very, very easily cause signs and symptoms of fusion, disorientation, really hard on their body and also hard on their spirit and on their mind. What's difficult is the diagnosis is not simple. And that is something that as we're rolling into, especially launching this immigration outreach, making sure that we are pointing towards resources for where they can get that diagnosis and making it as simple as possible. To be honest with you, a diagnosis is probably 3 to 4 visits. They're going to want to rule out anything else before they go through and move into that Alzheimer's and dementia diagnosis. And that's frustrating. It's anxiety inducing. So we're really trying to make sure that people are as educated as they possibly can be and making sure that they're prepared for what that diagnosis process can look like.
And once they have that diagnosis, you said there is no cure, but are there medications to help alleviate some of the symptoms? Or
yes, and the term you use is perfect. So there's 3 types of medications that help manage symptoms only in the early stages. So it's only good if they've had an early diagnosis and only for a short period of time. For those who've been watching the news the last 2 weeks on February, good Lord, let's not go backwards now.
No.
June 7th, aducanumab was passed by the FDA. And this has caused all kinds of hullabaloo across the nation. This is the first Alzheimer's medication of its kind that actually slows down the progression of the drug if it's used in the very early stages, and it's only really able to be used on certain types of Alzheimer's or dementia. I always like to compare it to a cancer treatment because obviously I'm going through cancer treatment. Not every treatment is going to work for every cancer or every patient. Although we would love to have a pill that we could give somebody that would cure their Alzheimer's or dementia. This is going to be more along the lines of how cancer works, where there's going to be multiple types of treatment because there's so many different types of dementia and Alzheimer's. But it was a big win for that medication to be passed.
Okay, awesome. And I just have one other question, and that is, you talked a little bit at the end about outreach and some of the things that you're wanting to do with churches and with predominantly African American churches, and then with the Latino community. What would some of those things look like? Are you talking about workshops or classes? What?
I love that question because what should have been on that slide is help. And the true fact of the matter is there is so much work to be done.
Yeah.
We have 3 populations that we know that are more impacted, but when I look at our programs in education, they are not represented.
Mm-hmm.
And so that's what has caused this. Okay, I'm tired of showing this slide. I want to change who is actually showing up to our programs and getting this information. So for the current, what we're going to be launching for our Latino immigrant population,
mm-hmm.
If you have access to any groups who would benefit from short amount of information that'll be in Spanish, that will be in layman's terms, that basically just talks about what the disease is. Because we know that term Alzheimer's and dementia, when you're working with a Latino population, it doesn't always translate, and the cause of it can be very, very broad. A lot of times we hear people call their loved one crazy. I don't know about you, but there was always the auntie in the back room who sometimes people would go in and talk to, but nobody really knew what was wrong with her. They would, and sometimes you had to talk quiet because auntie was upset. That's what I grew up with. 20 years ago, we didn't talk about this disease. So with our immigrant population, we're trying to roll out the education slowly. So that way we can start to do larger 1-hour education programs where they can actually ask questions and interact with other Spanish speaking educators who can answer their questions. So if you have access to a group who you think would benefit, please send me an email. For our Black African American community, what I need right now is I need a couple volunteers from that community who can really help educate me. I try to take a back seat and listen and support. I really want to acknowledge that I don't know the culture, don't know the family dynamics. This is an opportunity for me to learn, support, and to reach out and touch as many people as I can. So if you are passionate about this cause and you're a part of the Black African American community and you would love to give me feedback, ideas, any or all of the above, or even connections, I am completely open to that. But I think it's incredibly important that, especially with this disease, more so than others, the family dynamic is so incredibly important.
Mm-hmm.
It has to be taken into account because it's not what the white Caucasian community experiences. When we look at who's in long-term care, it's the same conversations I have with our Amish community. We have a huge Amish education that we do in the Topeka area. And we have 3-year-olds all the way up to 90-year-olds who attend the support groups and educations because they take care of their loved ones as long as they possibly can. So I really believe it's a chance for me to step back, listen, support, and hopefully be able to find people who are passionate and that can help guide me towards what this should look like.
Maggie, thank you so much for that. We have heard you, everybody here on the coalition. We've heard the needs, and just looking at the chat, so many of us have been touched by Alzheimer's personally, and I know that many of us deal with it professionally as well. So this is an issue. We also saw the disparities. So this is an issue that touches underserved populations in disproportionate numbers, and we wanna be supportive of this effort and see what we can do as a coalition to come out and make a difference. Right? That's what we're supposed to be doing, right? Making a difference.
Absolutely.
All right. So Patricia is saying, please keep us in mind for the walk. I saw also a message in the chat from Diana. She wants your contact information. So if you can put that in there, that would be great, Maggie. Okay. Anybody else have any questions that I perhaps have missed? Okay, Kalila?
Yes, correct. Thank you. I wanted to ask you, Maggie, what I noted in my father, he's passed away now, and in my grandmother as well, that there were times when they would it's like they would come out of a fog or something and recognize people, recognize names, but then kind of like almost as easily as they came out of that fog, they went right back into it. What is that and why does that happen?
So that is so incredibly painful for the family members. It is so incredibly painful for the spouses and the children who all of a sudden they remember your name and you just think that they're getting better only for them to slip back and be worse the next day. So it's common for somebody to have what we call lucid moments where they're themselves. And we don't know why it happens. We don't know what allows those neurons to begin firing again. What's so frustrating is this person potentially can go through and remember their high school basketball coach's name, but they won't recognize you as their daughter. And it is tragic for our families. It's common to have lucid moments. And what I always have to continue to remind people is that it's degenerative. Even though they're having a stretch of good days, they are still in a disease that will continue to get worse. So I always tell families that you enjoy the good moments, you try to tough it out through the bad moments. And I always say that laughter is truly the best medicine in this disease. There are going to be some really silly things that happen. I had a wife and husband. The wife kept waking up in the middle of the night. She couldn't recognize her husband in the morning. She would apologize to him because she said that she cheated on him, that she was being unfaithful, not realizing that the man that she was sleeping with was actually her husband. Mm. And it's heartbreaking, but you also have to smile and you're like, well, that's a little silly. We have other people who are removing the wheels from the lawnmower to keep their loved one from over mowing the lawn. Mm. These caregivers are living with it 24/7. And I tell them, if you can't laugh during the silly moments, it is just going to be a really, really long and hard disease. So lucid moments, although they are tough, they're a blessing, and we should enjoy them whenever they happen.
Any other questions? If you have a question, just go on ahead and start talking because I cannot see everyone. Okay. So it looks like we have run out of questions. Maggie's contact information is in the chat. Thank you everyone for participating. Thank you, Maggie, for that great presentation. Thanks again for that. I know we all learned some things. So right now I wanted just to give a brief update of where we are, Health Visions and the Vaccine Messaging Task Force. I know that I've been talking about this for a couple of months. Health Visions did form and create a task force where a couple of you have participated. And our goal is to bring awareness and access concerning vaccination. We are now we started out doing a lot of registration work, having interpreters go out to different places and help people to register, to cut down on the barriers that prevented people from doing so, lack of technology, not speaking English. And so one of our great partnerships with that was with Community Harvest Food Bank, Maya. We sent teams of interpreters there, and they would register dozens and dozens of folks on a Saturday, and hand out information to people who did not have it. Now we're moving into pop-up vaccinations. It seems that we have the ability now where we can work with some clinics like Neighborhood Health, hi Cindy, and Super Shot. And there was a doctor's office that we were working with as well. And they have been going to some actual locations in the community in Southeast and allowing people to be vaccinated right there on the spot. Catholic Charities has done a good job with that as well, in some of the Burmese apartment complex, well, not Burmese, apartment complexes where large populations of Burmese live. And so we are steadily doing that, trying to make it accessible. Things have slowed down because right now, many of the people who were eager to be vaccinated got vaccinated. And that's nationwide, that's a national trend. And so now what we're seeing are, it's a slower pace, but people are still out there wanting to be vaccinated, especially people who are not fluent English speakers. We are still finding some eagerness within the Latino community and the Burmese community to be vaccinated. So we are still partnering for those types of events and bringing awareness to African American churches and things like that. So some of the things that we have coming up that I want to let you know about is Health Visions is partnering with Super Shot in July, and we will be doing 2 events. On the 23rd, July the 23rd, we will be at Super Shot for what we're calling Back to School Vax. And Super Shot is an agency here in the community that targets vaccinations for youth. For this event, they will be targeting youth as well, but also be offering to adults who come. On the 23rd, we will have kind of a fair style, health fair stylish event at Super Shot on Hobson Road. And we will be targeting Burmese population. So people who are of the Burmese persuasion can come out. Anybody can come out. We're not going to turn anyone away, but we will be advertising to those populations. There is a significant Burmese population surrounding that Hobson Road area, State Street area. They have some restaurants and grocery stores there, and people will be able to come get information at vendors' tables. So we are hoping that you and your organization would be willing to come out, set up a vendor's table, and give out information about your organization as well, and offerings, services that you offer. And we will also have some ethnic style finger foods for people during this event, and then people can go inside and get their children vaccinated for the school year. And of course, COVID vaccines will also be offered. That's July the 23rd. We'll be sending some more information out about that. On July 30th, we will do the same thing at Super Shot on Hobson Road. We will have a fair style atmosphere, vendors with information to hand out, swag, what have you, ethnic finger foods, but this time we will be targeting Latino population. So that will be July 30th. So July 23rd and 30th, Health Vision Super Shot will be hosting this event. We hope that you will come out and join us. Please let us know by the 30th if you are interested in participating as a vendor, giving the community some information about it with either one or both. So send me an email and let me know that. So that's what we are doing that I can talk about definitively. And then also we're going to send you links to our survey. Have I talked about the survey with this group? Okay, so we have a survey that we have created with the Indiana Minority Health Coalition to gauge the temperature for vaccination now. Why are people not being vaccinated at this point? Even though many people have been vaccinated, in some of our underserved communities, 4680306 and 46816, those percentages are still in 03 and 06 in the 20 percentile. 46816, I think they're in the 30s at this point, judging from the last set of numbers that I got from the Allen County Health Department. So whereas in the Southwest over by Jefferson Point, they last count had more than 70% people vaccinated. And the countywide average was 44, 47. Anybody know? I'm not remembering. It was in the mid 40s. So these populations that we focus on and serve are below the average percent, or below the average percentile. So we want to, again, we don't want to condemn people for not being vaccinated, but we do want to create opportunities for those who want to be. Again, when Catholic Charities, and when we also have set up events in Burmese venues, there have been times when they've been lined up before the actual event started, which lets us know that they need someone there who speaks the language and has a relationship with them. Okay. Latinos, non-English speaker, are also, many of them, wanting to be vaccinated. There's just a lack of relationship. With African Americans that we have been working with, some of them it's a lack of convenience, and also some misinformation that's floating on out there. So we want to help with all of those barriers. But again, if someone just doesn't want to be vaccinated, that's fine, don't be vaccinated, and plus it's an issue where you need to talk with your doctor, maybe there are health reasons. So we don't want to condemn anybody, but we are putting on these events. We welcome any of your participation. I see some stuff going on in the chat. Let me see, Sharon, what is the volunteer need looking like? Any updates on that? I'm going to defer that question to Felicia, who's not here today. And I don't think our HEC people have met Felicia because she doesn't work on Thursdays, but I will refer that to her and she can solicit volunteers as the need arises. So Felicia is our virtual programs and community partnerships assistant, and she does a lot with the task force and with some of these vaccination events. And we will put a call out for volunteers when we kind of figure out how many vendors and things like that we have. Any questions about what I've said? We'll be sending you the link to the surveys, by the way. That's why I brought that up. So we have the surveys in English, Spanish, and Burmese, and we will send those links out to you. Okay, and if you are on our list, our newsletter list, you already have the links because you got my newsletter yesterday and it has all this information in it. So if you would click on that newsletter, it says Health is from Health Visions Midwest, news you can use. You will have that information right there at your fingertips, as well as some very interesting stories about things that are going on in our community concerning health. Any other questions? Is there anything in the chat? Because somebody looking
Yes,
at
Sharon, Pat Turner wants to know what time is the event at Super Shots?
Okay, yes, we were finalizing those times. Right now, I'm going to say 4 to 6, but that needs to be finalized and we will get that to you. Okay. Anything else? Okay, so now we're going to open up the floor to our community sharing. Anybody out there have anything to share with what is going on in your organization or community news that you want to share?
I have to get off soon. This is Diana Jackson
Yeah.
Davis. Hey, and we have the workshop this evening. We've actually had a 2-day LGBT plus workshop on identities and terminologies. And we had the first one on Tuesday. And honestly, I was expecting maybe 10. We had over 47 people attend.
Wow.
Which, yeah, and so we have another one, the same one tonight. And I'll probably have to say, I don't think the team meeting, in the link itself got in there, so I'll have to send it to you as an email. But what we decided was that we're going to actually have a part 2, because I was surprised. We had physicians, we had leaders across the system and community leaders involved. And it was really amazing, but it opened up so many questions that we thought, okay, we have to plan a second class. So the one tonight is actually the same class, but we don't know how it's going to go. So if you're available to attend it, please do. It was a real, I mean, Drake and Maria, they did an excellent job, presenting and, opening up to open up so much discussion and dialogue on the issue, because very often the LGBT community, even when we are talking about issues, they're often left out of the conversations. And so I just wanted to share that. And then the second thing is, Betsy's on, we're still looking for volunteers, and I'm sure she's going to talk about the International Village. So I'll let her make that announcement, because we definitely need volunteers and some other things. And so she's on already. So that's all I have. Thanks.
Thank you so much, Diana. And I just want to make note of what Katie is saying in the chat. Yes, so I wasn't sure if Neighborhood Health had finalized that event on Monday with Wayne Township. I was talking about some of the pop-up sites, and Neighborhood Health, they will be utilizing their mobile unit. They now have a mobile unit that they're going to be going to various locations and venues in the community, and they will be able to do some vaccinations out of that unit. And so the first one is Monday, June 28th at Wayne Township Trustee Office. I, again, wasn't sure that they had finalized that. She's got the information in the chat. So please spread that information to your clients and constituents. Thank you, Katie. She may have already been off. Okay, so who else? Who's next? Nobody else has anything to talk about?
Yeah, this is Peggy from Health Visions. We're having a community health worker class opening again on July 15th. So if you want more information about it, please go on our website, hvusa.org, to get more information. I can put that in the chat as well.
Okay, we're training community health workers. Thank you, Miss Peggy.
You're
Elka,
welcome.
your hand is up.
Hey, Miss Sharon. Hey, everybody. Just a real quick sort of like heads up, save the date kind of thing. And this is piggybacking off of what Diana was just mentioning about our L Plus staff members who have been conducting those L Plus trainings and workshops. PADAG, the People of African Descent Advisory Group at the center, will also be hosting a screening and discussion of the documentary Holler If You Hear Me, Black and Gay in the Church in July. And I believe, Ms. K, correct me if I'm wrong, but I think the date for that is July 17, I want to say. So we will be sure to, get info out as that info gets, compiled from marketing and development, and flyers and things like that go out. We'll make sure that everyone gets updated on that. Thanks, Sharon.
Okay, thanks, Elka. She said, because I know some of it was a little bit hard to hear. Holler if you hear me. They're going to be sharing that documentary for the LGBTQ community, or about the community, right?
Yeah, the documentary is called Holler If You Hear Me, Black and Gay in the Church.
Okay.
This is something that we are doing in honor of, Black and brown queer folks in our community. So little focus, so little attention paid to those communities. We work really hard to try to serve and acknowledge and represent those communities. And so we'll be doing that screening and discussion at ACPL Theater on July 17. So as details, get ironed out for that and the info becomes available, I will make sure that we get that sent out to everyone. I apologize if folks are having trouble hearing me. I'm on my phone and it's acting kind of weird today. So apologies for that. But if people have other questions, please feel free to contact me.
Anybody else? What's going on?
Well, since Diana did a little teaser, I will tell you a little bit about International Village. Not exactly health related, but it's a lot of fun. It is part of the Three Rivers Festival. It is this year, July 16th and 17th, Friday and Saturday from 10 until 9. And we could use some help. I'm still actually looking for some folks to perform on the stage. So if you know some people who are have not been able to perform anywhere for the last 2 years and are jonesing for an opportunity to have some audience, I would be more than happy to schedule them. We don't offer any payment for that, unfortunately, but we can provide them a voucher for some food at one of the tents in the village. So it's a really good time and I highly recommend it.
Betsy, perform how? What, sing, dance?
Yep. Any of the above. Diana's going to read stories because she's been doing that through the pandemic on social media. So if you haven't caught any of those, she does a really nice job, even dresses up. The only requirement really is that it be multicultural in nature in some way, which isn't really all that limiting because we all have a culture. And so whatever is unique to your culture that is appropriate for a family audience, we would be singing, dancing, music, stories, lectures, short half-hour segment is kind of what we're looking for. Yeah, so that would be a lot of fun, or just come and help, or just come and eat, come and support it. It would be great. Other things that I'm involved with, of course, are AARP. We're not meeting yet, of course. Well, not of course, but we're not. But we have done quite a few interesting virtual webinar podcast sort of things. So if you've not been following AARP Indiana lately, we did a really interesting one not too long ago on evictions, which is a big issue for health reasons and all other reasons. We're working on kind of following that up on one that will talk about accessory dwelling units and why you can't build a little piece of home onto your home in your neighborhood in Fort Wayne and Allen County to help care for your senior relatives or whoever else you want to hang out with, and what the options might be. And of course, COVID and all sorts of other things.
Wonderful. Thank you, Betsy, for that overview. Hey, listen, everybody, we are at 11 o'clock. I want to remind you that we are not meeting in July. So July is our month off. And then August, we will resume our virtual meeting. September, we will have our in-person meeting for members. If you are not a member of HEC, meaning that you have not paid your dues, you can still do so. Let us know. Send Carla Harrison an email. Carla, please put your email address in the chat so that they can send you a quick email and get the information. But we are going to be ordering our t-shirts. And so we'll have the t-shirts and we will be giving you some more information about what's going on in September. And also we will be assembling a committee for our our first annual A-Check conference breakfast in April 2022. If you're interested in being on that planning committee, please let me know. stubbs@hvusa.org, or you can let Carla know because she put her email in the chat. So any questions? Anybody else have something real quick that they want to share with us? I guess not. And so that's it, everybody. Thank you so much for coming out. Thank you for logging in, and we will see you again in August. Bye.
Bye, Sharon. Love you. Bye, everybody. Have a good day.
Bye-bye.